The vasectomy is one of the most common procedures we do here in the office. However, it's probably the most anxiety-provoking procedure for the patient. It's something we do in the office. It takes about 20 to 30 minutes. We take our time, never in a rush. It is probably the safest and most cost-effective way for sterilization. The vasectomy is really the first part of the sterilization process. I always tell my patients, I cut, you clean. Once we ligate the vas deferens, which is the tube that connects the testicle to the outside world, or it's really the highway that the sperm travel in, we have to clear the rest of the pipes. And it takes about 25 to 30 ejaculations until we get all the remaining sperm out. And only when a patient has a semen analysis that shows no sperm do we consider him sterile. We do micro incisions about the biggest as the size of a pencil eraser. We remove a piece of vas and cauterize each end, and then sew each end downstream, and then put it back into the skin with a little stitch in the skin that dissolves in a few days. The most important thing a person needs to remember is they're not sterile right away. The second most important thing is they need to take it easy for about 3 days, and they really need to be on their bottom more than their feet. When they go home, their job is to really just chillax, to just ice down the scrotum the rest of the day until they go to bed. Most guys just use ibuprofen for pain. We always give something a little stronger. Rarely do we need to use any antibiotics, but in certain patients we opt to use antibiotics. For about 3 or 4 days, just take it easy, and really a week and a half until they get to more aggressive activity, running, biking, jogging, and then sex 4 or 5 days. Frankly, you really won't need me to tell you. If it hurts, stop. And that's really the rule of thumb. Don't hurt yourself. And most guys, that's the hard part, is they feel pretty good, but once they get a little active, they're gently reminded that something happened down south. And then about a week and a half, they're feeling pretty good and they can resume all activities. I typically do not make a patient see me after the procedure, especially if they're doing very well. If they have an issue, I have them call me. If I think they need to be seen, I just tell them, come on in. I'm not here to charge them for those visits. I'm really here to make sure it gets done right. After they have that final semen analysis that shows no sperm, they're free to roam. We don't have any long-term follow-up unless they have a question or ever need us. We're more than happy to see them back.